Assalamu alaikum. Hello, everyone. My name is Dr. Nورالدين. I'm a clinical associate professor at Texas A&M College of Dentistry and the cardiology director at the school. I'm very honored to be invited by الشام, a private university, to give a talk about one of the breakthrough in dentistry, which is the silver diamine fluoride. Let me get to the presentation and share the screen to talk about the what, why, when, and how, which is eventually everything about silver diamine fluoride, but in a very concise manner due to the time. And I have a disclaimer. I have no financial interest in the SDF product discussed here. And I'm really a big fan of science of prevention, and I will be forever a student because science keeps revolving and never stop discovering. I would like to start with this case of a 12-year-old kid who has thalassemia with extensively dry mouth, extensive xerostomia. You would imagine how this kid teeth would look like, rampant decay in every single tooth, and we can call it a fire in the house or house on fire. So eventually our line of treatment would always be going to the OR or the operating room, sedating the kid or putting him under general anesthesia, and then go ahead and drill and fill the teeth. Also, the same applies to adults, where we have some of the teeth that needs attention and needs treatment, and we will go ahead and drill and fill. So let me ask this question, which could be tough and not a tough question, because it's really intrigued me for years. Treating caries without restoration, is that possible? If we take a moment and think about it, we always over the years treated caries with restoration. But how about treating caries without a restoration? How can we do this? And the answer would come in a nutshell of silver diamine fluoride. So what is silver diamine fluoride and why we're talking about it? Well, silver diamine fluoride was developed in Japan half century ago. And since then, it has been used in many parts of the world to actually attenuate the dental caries infections. And since year 2000, the clinical interest has been enormous towards the silver diamine fluoride. And later on, we will see so many evolutions that took place in the United States and consecutively, of course, in Europe and in the Middle East about silver diamine fluoride. Usually when I give presentation, I like to go in the what, why, when, and how. Once we know the what, we are able to know why we're doing it and when and how we're doing it. And it applies to every matter in life. So we need to know our material, to know the strength, the limitations, so we can actually understand why it's a breakthrough, why it could be a solution to treat caries, but without restoration. So in year 2014, the FDA cleared the treatment of the silver diamine fluoride for hypersensitivity. And in year 2016, it actually gained an FDA breakthrough designation because it was able to arrest decay. And the word arrest tooth decay is a really profound and huge word. To be able to arrest the tooth decay, we've known for years and years and years. Since I graduated, you need to remove the dental plaque, you need to brush, you need to make the tooth very much accessible, and maybe not. There will be a rest. Once it's cavitated, it will be very hard. But with this material, there was a different story behind it. And since this declaration and since it arrived in the United States, actually it has been a huge interest towards the silver diamine fluoride. And if you go to PubMed and do the search, writing silver diamine fluoride, and diamine, by the way, the correct spelling would be with 2 M's, not 1 M, as the way I'm writing it, or it's on the this product. But if you write it this way, or write silver diamine fluoride, or SDF as an acronym for it, you will find more than 7,000 results, which describes the large body of research directed towards this product and its potential actions. I was very honored 2 years ago to be invited to write a chapter in the a novel textbook about the medical management of caries. It has all the story of the silver diamine fluoride, its application, how it can be used, limitation, strength, when, what, how, everything is in this book. And we had 32 authors across the globe who participated. Dr. Steve Duffin drove the entire march to produce this medical management of caries textbook. You can purchase it from Amazon because it's a really valuable tool to let you understand how we can manage caries without drilling and filling. Now, the SDF, real quick, it's a colorless liquid, and it has a pH alkaline, it's 10. So it will make it very, very acoustic to tissues, as we will see. So the silver diamine fluoride, from the name, it has silver, it has diamine, it has fluoride in it, and there are certain percentages of each of these components: 25% silver, 8% ammonia, fluoride, and water. And the fluoride as a 5%, we can say it's a 44,000 particles per million. And of course, people who deal with the fluoride products understand that this is double the highest professionally applied fluoride varnish in the market, which is 22,600 particles per million, while the fluoride here is 44,000 particles per million. So let's get into why we're using it. So that's the what. Now, why we're using it. This is the same exact mouth of the 12-year-old boy with thalassemia. And this is after the application of silver diamine fluoride. When the kid came back after a couple of weeks to see his dentist, and you will know in a couple of minutes how to apply the silver diamine fluoride. When he came back, the teeth were extremely black stain. Also, hard as a rock. That's the arrest that we are talking about. Nothing has been touched in his mouth using any excavator or a handpiece. Nothing was touched because he was very sensitive. He was much in pain. So applying the silver diamine fluoride in an easy brush, and 2 weeks, the patient came back with arrested decay. And also interesting, they found in many cases and in many studies that these patients didn't develop decay in later in all their sound teeth. And also there were healthier gingivae. These were observations which was really profound and amazing. And now each ingredient you should know. I'm going into the depth of what is it and what it does, because it gives you an indication of what is this material, so you can use it with strength. Silver, it's bactericidal, and this is where it comes that the gums are better, the no decay happening afterwards, because it is bactericidal. It kills the bacteria. It prevents its growth. Ammonia, it's a solvent, and actually it provides stability for the silver diamine product, and it gives stability for this product, so it won't go bad, if we may say, quickly. And the fluoride, it is for the purpose of remineralization, which is a profound aspect of it. So we're not only remineralizing, we are arresting, we are killing the germs, and this is really a total concept of a medical management of decay. Now, I will go real quick about the why we're using it as well. It is for the hypersensitivity, because of the extremely big amount of the fluoride that blocks the dentinal tubules. Also, the presence of this fluoride and the ions, it can, silver ions, it can penetrate very deep into the sound enamel as well as the sound dentin, and it causes the remineralization, and it prevents the bacteria from growth, and actually kills the bacteria, and provide opportunity for the fluoroapatite to be formed, so it will give us a remineralization potential. And once it's there and it's kept within the enamel and dentin, it can actually give what is known by halo effect. The halo effect, that the dead bacteria with the silver ions inside of it, if it comes near to a living bacteria, it actually kills this living bacteria. That's the halo effect that we can see, and it's called the zombie effect by the silver diamine fluoride. Now, this is a study, a clinical study that I carried out 3 years ago. We started it, and then it went on, where we had geriatric patients, elderly patients, and we applied the silver diamine fluoride. And actually, we noticed after 3 weeks, improvement, humongous improvement in the health of the gingiva. This patient is not brushing, and they have extensive amount of dental plaque. We noticed that less amount of dental plaque being formed without even brushing, and the gingivitis, the inflammation, the redness subsided to a great extent. Now, what are the limitations? As we can see, black stains, dark, very dark, unpleasant, not our dentistry, but tell you what, the number one, the sound enamel and dentin does not pick up this dark color at all. And this is why you can see the dark color in only in the gingival sites right here, but not along the labial surface or the incisal edges, because it is sound. Also, the soft tissue could be stained, but this is temporary, like the gum or the lip. If parts of the SDF came across this, it's going to be stained, but it disappears within 2 weeks. It has a little bit of unpleasant taste, but the patients, we can eradicate this by toothpaste or by applying fluoride varnish on top of it. There were several studies asking about acceptance of parents, acceptance of patients as regard to these staining. And actually, it's amazing that patients in those tight situations accepted the SDF application. One important and very important aspect when to apply it. When we have an extremely xerostomach patient with extremely dry mouth, like this thalassemia kid, it's very important to control. It's very important to apply such material which will provide the arrest. It will provide prevention. It's a very profound tool. Also, when the patient cannot do a treatment right now, he doesn't have any financial ability to go and fulfill the requirements needed to prevent decay progression, you just apply the silver diamine fluoride fluid and just leave it there. It will arrest the decay. He can come back, and actually we can restore afterwards, or we put a restoration if it is a cavitated lesion. Also, in the difficult to manage patient, medically compromised patients, or patient with developmental disability, and you cannot control them, this is a great tool. It has been very successful with kids because you can even, it started in the United States before the approval in the kitchen, being applied by Dr. Steve Duffin and several patients, several kids, because it doesn't need complicated procedures. Also, very important to note, the patient should be asymptomatic, doesn't have symptoms. So it should not be used as a direct pulp cap, or if there is a pulp exposure, but it can be used when the patient is asymptomatic. Also, newly erupted teeth, pits and fissures that started to decay, all of this, just apply the SDF and it will arrest it, turn it hard as a rock. And also, it has been used also as a root canal irrigant because it is antimicrobial, which is very important. It should be contraindicated if the patient has silver allergy and has mouth sores or enog, which is the ulcerative gingivitis, or the direct pulp capping, as I said. Now, is it really a cure for all? I would say no. SDF is not a cure for all. It is kind of interim treatment, and you should know that that there will be a plaque staining, and 11 to 32 of the cases cavitated. Maybe it will keep growing, but you won't lose anything from refraining from drilling or refraining from digging more and stepwise excavation. You can just apply the SDF, wait, and let the patient come back and see all of this deep, mushy decay will turn hard as a rock, and you don't need to drill, you just apply a restoration. Now, how we do it, again, real quick. In the United States, we take an informed consent from the patient because there is a dark stain. So we have to have their approval. And as simple as you can see, a brush, the silver diamine fluoride, and fluoride varnish to protect the surface. Be aware, everything has to be covered. You have to wear gloves, and you can dispose everything. That's the product in the United States by Elevate. And it's called the Advantage Arrest, whether in a big bottle or in a small ampule that can be used once for 5 surfaces of the teeth. Another product is present called Rivastar. Rivastar, actually, they have potassium iodine. The company claims after you apply the SDF, you can apply potassium iodine so that it can actually prevent the oxidization of the silver and turning it to black. But with some research, it still does not make a big difference and the color turns to black. The SDF could be placed by itself or followed by glass ionomer. That's a huge area and it needs another big presentation. But you need to select your case, you need to know your frequency protocol, you need to monitor the patient so that the lesion doesn't progress. I'm not going to go through this, it's just give you a glimpse. So because the time for the presentation is limited, I would tell you that we put Vaseline everywhere, on the gum, on the lip, but of course not on the tooth because we want the lesion to be accessible. So we will just dry. No removal of mushy decay, no removal, no usage of a handpiece, nothing. Just dry it as much as you can and then apply the SDF using the micro brush in there. Let it soak in for at least 1 minute. No rinsing, you don't need to rinse. Apply fluoride varnish on top of it to mask the taste and actually to protect the SDF in its position. And then leave the patient for 6 months. He will come back with a very hard lesion, but it depends. I'm not gonna say 6 months as a solid, but it depends. And I will say in a minute, what do you need to do? Now, the patient can come back with a lesion that is hard as a rock, arrested, and nothing to be done in such lesions, especially in children if they are gonna shed these teeth. Also interproximal, you can use the super floss where you can apply the SDF and just pull it out. And the SDF is for the interproximal. If you have a large lesion, I would suggest that you apply it several times, ask the patient to come after a couple of weeks, reapply again, and you will immediately notice the dark color within minutes of application. And you tell the patient it means it's working when we have this dark color. And just ask the patient to eat and drink. There is no need for refraining from eating or drinking afterwards. It's very important to document that you have SDF because it doesn't show in the X-ray. It shows that the lesion is still there, the caries is still there. We have a technique called SMART where you put the silver diamine fluoride and then you put glass ionomer on top of it, and then you're done arresting and you're restoring with the very biocompatible material. I would advise that you go ahead and look at the JADA 2018, where the ADA gave some guidelines and they actually advised to use the SDF solution for the lesions and for treatment of decay. Thank you very much. I'm very honored to be presenting with El Sham University. Thank you.